Once upon a time, there was a fine, beautiful lady in my home country. People grew fond of her to the point that they started calling her great names because of her beauty. She not only was gorgeous, but she was classy. Her outfit spoke how fashionable she was, a woman of great caliber. She used to be a classmate to my uncle, and he called her the Great Queen of Devis. She loved burgers, rice, together with milk. She also used to eat food full of oil about 5 times a day. That made her feel full of life. She started looking a lot more beautiful than ever before. However, she got bigger but not better. Eventually, she started feeling pain in the heart. It was hard for her to move. Running was a problem. If something happened, what do you think she could do? If war broke out in the country, do you think she could run? Obviously no. She started lacking self-esteem because of her status. Regardless, she was still beautiful because beauty was in her blood.
These foodstuffs aren't bad per se. However, they pose a risk to your health and most likely lead to obesity if taken too often throughout the day and other unfavorable conditions. Why?
Insulin resistance is the major reason you risk the health you enjoy now. What is insulin resistance? Your cells rejecting more glucose energy through them because of too much carb cravings.
Insulin resistance is what you and I are interested in. You will appreciate the scientific explanation in an easy manner. Let's begin from the source as promised. To make things clear, in type 1 diabetes, patients have got no insulin to release into the bloodstream, whereas in type 2, it's usually insulin resistance failing to bring down the glucose level. So we really need insulin, right? Well, what happens if you eat too much carbohydrates, especially refined ones, every day and several times during the day? We shall discuss that in just a moment. What is insulin in simple terms? Insulin is a chemical hormone produced from an organ called the pancreas from the delta cells, and it controls the glucose level in the blood. How does it do that? Hi, you are live to Health Need, where we provide you with up-to-date scientific research information on health and fat metabolism.
Most people think it does not affect them. They say it's only for diabetes patients.
First and foremost, what is insulin resistance and how does it come about? Insulin resistance is loss of the cell's sensitivity to insulin resulting from incessant glucose spikes over time. Regardless of whether you have diabetes or not, insulin is there to do its job. Why do you think those having diabetes cannot do without it in the first place? It is the same reason you need insulin. Where does insulin come from? Insulin originates from the pancreas, particularly from cells known as islets of Langerhans. The pancreas is an organ just underneath the stomach beside the duodenum, subdivided into 3 categories of cells. They include delta cells, alpha cells, beta cells. Beta cells produce insulin. Insulin reduces the amount of glucose in the bloodstream. Glucose is converted into glycogen in the liver and muscle in a process known as glycogenesis. What exactly does insulin do? It binds on the receptors of the cells. This allows the pores to open and thus entry of glucose. It communicates with these receptors for this to occur. We discussed what insulin is, where it originates, and what it does. Yet to be revealed is dangers involved if you are insulin resistant and how to combat it. What happens when you eat carbohydrates? Glucose is elevated. When this happens, the level of glucose has to be regulated. Thus, insulin is released from the pancreas and it begins doing its job. What if you eat a high-carb diet incessantly during the day and every day? Over time, you may develop insulin resistance, and the reason, too much of anything is bad. Are you willing to face that? What really happens? The cells are staffed with glycogen and fats all the time, and hence cannot allow any more entry of glucose. Over time, the receptors lose sense to insulin. Now, even if the amount of glucose was to reduce to normal in the bloodstream after being used by other non-insulin resistant cells, you would still have insulin resistance. The fact that you have insulin resistance means that you are either on the way of having diabetes type 2 or you have one. The question is, are you aware of what you are getting yourself into? If you are insulin resistant, you may be pre-diabetic without knowing it yourself. How would you know you have insulin resistance in the first place? If you have the following: frequent hunger, cravings, weight gain, skin tags, high blood pressure. How would you fight insulin resistance whether you have diabetes or you are pre-diabetic? There are certain methods that have worked for some, but not for everybody. Are you ready for this? If you have tried doing that, Have you lost weight at all? Maybe not. Well, are you ready to go for a scientific approach that guarantees results? Have you prepared yourself to get rid of excess fat? Subscribe now and get the best way to tackle insulin resistance. Why procrastinate if you have at your fingertips what solves your unsolvable problem? Get yourself a free spot now.